Hi everybody, this is Jenny Guthrie at Glow Medical Aesthetics. I'm a nurse practitioner and owner of this fabulous facility. I want to talk today about one of my very favorite procedures, and it's one of our top requested procedures here at Glow Medical, and that's dermal fillers. What are dermal fillers? Well, they're basically a hyaluronic acid gel, which is a naturally occurring substance in our body, but these gels have been made and designed for very specific parts of the face for restoration of what we call facial balance, replacing volume as we age. We lose bone projection as time marches on. We lose fat pad support in our faces. We get it everywhere else in our bodies, but we lose it in our faces as time goes on, which is just the cruel reality of things. But the beauty of it is that we have these hyaluronic acid fillers that can help restore those things that we lose as time marches on. Facial aging occurs much earlier than most of us think. It starts actually in our 20s. It's not something that we need to be thinking about when we hit the big 5-0, but it's something that we need to be thinking about much earlier if that's a priority and a concern of yours. And dermal fillers made with hyaluronic acid are one of our #1 procedures that we have to correct these things. So what can you expect when you come in for this procedure? Well, we're going to send you some forms ahead of time that we would appreciate your filling out. Some of them have your pre and your post instructions, so you can be best prepared for these procedures, how to take care of yourself leading up to receiving them, and how to take care of yourself once you receive them and once you go home. So when you come in, we ask that you come in with a freshly cleansed face. If you can't, that's okay, because even if you come in with a clean face, we're going to have you wash your face again here in our facility. Why do we do this? Not because we're bored and we have nothing else better to do, but think about the number of times you may touch your face between leaving your home and coming to our office. If you've received a phone call and your cell phone has touched your face, you've touched your steering wheel, you've touched the doorknob, you've touched the countertops, you've touched your sink faucet, who knows, and then you've touched your face. And what have you moved from those objects to your face? Potentially bacteria. And that's a big no-no, because a safe injector is a clean injector. And the cleanest that we can be in your procedure is going to set you up for success after the procedure to really enjoy your fabulous results. So you're going to need to come in with a clean, freshly washed face. We're going to have you wash your face again. If you can avoid alcohol, Aleve, ibuprofen, aspirin, certain vitamins and supplements like fish oil, turmeric, vitamin E, anything that thins your blood will increase your likelihood of having bruising, which can delay your recovery just a little bit. It's not the end of the world if you have a bruise or if you've been on these supplements or you've not stopped them. That's okay. We will still be able to perform your procedure, but if bruising is a significant concern for you, then that's something that we would request that you avoid. We will be having you fill out a medical history, and we will be reviewing your medical history, because as fun as these procedures are and as much as we love them, they are medical procedures. This is medicine. It's fun medicine, and it makes us all feel good and it makes us look good, but we still have to respect it as such. So we're going to ask you some medical questions and have you fill out your medical history. Let us know what medications you're taking, any health challenges that you may be experiencing. There are some things that we are always going to be cautious about leading up to your filler procedure. Because we are implanting a dermal implant, the HA gel, into your face, your immune system will perceive that as that something has happened. And so we want your immune system to be as absolutely calm as it can be leading into this procedure. So things like having a viral illness or a fever 2 to 4 weeks before your procedure, things like dental work, fillings and cleanings count 2 to 4 weeks before. Any vaccine, flu shot, COVID shots, booster shots, anything like that, we want you to avoid those 2 to 4 weeks before, and taking antibiotics for anything. It doesn't matter if it's an ingrown toenail or a bladder infection. Those things seem so far away from your face, but they really do impact your treatment. And so we want you to be off antibiotics a good 2 to 4 weeks prior to your procedure. Another one that a lot of people don't think about is tattoos. If you've recently received a tattoo, not just on your face, but anywhere on your body, that can trigger your immune system. So from that standpoint, we want you to avoid having tattoos 2 to 4 weeks before your filler procedure. These are things that we have set in place that are standards of care and recommended by the industry to protect you, our valuable patients, because we want you to have the best experience and we want you to have the absolute best outcomes possible. And by you avoiding those things, it helps us help you in that regard. So the procedure itself is relatively quick. Depending on the number of areas that we are treating, you may have to have a consult ahead of time, and that may take some time if we've not already done a consult with you. But you plan on being here at the office at least an hour, maybe a little bit longer, depending on your filling out paperwork ahead of time, or for having your medical imaging done if that needs to be done. And so expect that we will put a headband on. We are going to mess your hair up. And so that's just part of the procedure. But plan on being here at the office for about an hour to an hour and a half. I always hate it when patients come in and they book their lives so tightly, and I'm guilty of this very same thing because I try to cram as much into my day as I possibly can. But we hate you being stressed that you have to leave or you have to be somewhere. And we want, again, this to be a positive experience. And we don't want you being stressed and worried in the chair while we're taking care of you, because we want to be focused as much as we can on you, your results, your outcomes, and meeting your needs. So plan accordingly, please.